Hi, everybody. Good evening. My name is Ashok Hariharan. I basically work in the legal tech space. But today I'm here to talk about something completely different, something that is pertinent to all of us. And I have a very special guest here that I'm going to be having a conversation with. And I'd like to introduce Mr. Sean McDonald. He's the CEO of Frontline SMS, which is one of the oldest and still being used monitoring systems in the humanitarian space, which is based on text messaging. It's been around for over 15 years. He's also a lawyer in the international law and alternate dispute resolution space. And he's also a visiting fellow and advisor in various institutions. I mean, it's a very long list. So just to keep it short, I'll say Stanford Law's Digital Civil Society Lab. He's also on IEEE's Ethics and AI Committee, and he's been published in various outlets like Foreign Policy, Stanford Social Innovation Review, and even the Cornell Legal Information Institute's journal. So the reason I'm talking to Sean today is about something that concerns all of us, not just in India, but everywhere. We are here to talk about COVID-19, specifically about how technical solutions have been rolled out left, right, and center, apparently in a bid to save all of us. These choices have very deep implications beyond the immediacy of the pandemic. And what we will try and understand today is how will the widespread use of tech in response to the pandemic impact society and you individually as a person. So I think that aspect has been kind of missed out, how it affects you as a person. So I'd like to bring that out today. Sean can be considered as an expert in this area since he's been working in the space. He's also written extensively about it. He wrote a very detailed study of the use of call data records, which was an early kind of contact tracing during the Ebola epidemic of 2014 in West Africa, and also kind of spread to other parts of the world. The link to that paper is in the show notes. Plus, he's also written an article about the digital response to COVID-19. I urge you all to read both those papers when you have the time. So anyway, let's roll ahead. I'll let Sean talk. So Sean, my first question to you, just to get the proceeding going is, how is the tech solutions context different between the Ebola epidemic, which was 6 years ago, which is like a completely different era in terms of technology, and compared to now in the age of COVID-19. What do you see as the common denominator, and how has the scale and the scope changed since then? And what do you see as the lessons that were not learned since then?
Yeah. Ashok, thank you for that extraordinarily generous introduction. I'm really excited to have this conversation. Also want to thank Kaarana for convening it. It's really great to be speaking with people who are considering and engaging critically with so many of the sort of technologies and issues that are happening kind of everywhere around the world. So it's been really, really exciting to get to engage. In terms of what's different, you touched on it for sure. Scale is a major difference here. I think that one of the things that we really saw with the Ebola epidemic, and I think that we see a lot in terms of public policy focusing on technology in response to something like a public health crisis, is that it becomes a challenge of leadership. And I think that what we're seeing in the COVID response, and certainly in the ways that different countries are engaging, you have a really clear view that high quality leadership makes a difference here. And so much more so in many instances than the specifics of a technology. And so in Ebola, the idea was called detail records or mobile phone kind of back-end databases as the way that the technology that we might use to help track people. And what we're seeing with COVID is obviously much more app-based, much more sort of Bluetooth proximity. Some of what has changed in the last 6 years is we've gotten a much better sense of what the limitations of call detail records are, and how much more work we need to do to make it a technical solution that works. And I think that, we've also seen a lot of the apps fail in really big and public ways because they're consumer facing, because they're user facing. So call detail records happen essentially, their analysis and exchange happens mostly behind closed doors between public health institutions and mobile networks, international organizations, things like that. Domestic governments, obviously. Whereas here, what we're talking about is needing the public to participate by downloading and using and recognizing and integrating into their daily life some part of a mobile phone application. So I think that what the public is getting to see in a much more granular way here are the limitations of a technology, right? Apps crash, right? Whether it's because it's delivering you dinner or it's telling you about your medical results, apps crash. And so I think that one of the things that we're really finding here is what things we think are okay to do via apps, and what things, feel like an appropriate use of technology versus throwing a random technology at a problem and sort of hoping that we figure out how to make it impactful after the fact. And I think we've seen that happen in both responses, but yeah, scale is the main difference. Here it's happening globally.
So, also, I guess other factors like, the disease is different. It's got different incubation times. There are people who don't have symptoms. They get symptoms after 14 days. And also the fact that, the whole Ebola thing took place in Africa, which for most people is like, does not exist. It's out of their bandwidth of viewing. And well, now this has kind of come home, it's there everywhere. So I guess that is that also a big qualitative factor, I suspect.
Yeah, well, so a couple of things, and as someone who's run a business in Nairobi for a long time, I definitely understand both the visibility of Africa and that it's very complicated in that regard. I think that we you start off with to me, one of the most important points. We actually know comparatively a lot about Ebola, certainly compared to COVID. And what we're seeing happening in this response is that the science isn't really all the way there yet, right? We've seen big public institutions shift in the advice that they gave from the WHO. A number of national governments, for example, have changed their position on whether or not masks are important. I think it's pretty clearly proven at this point that they are. But you may remember that at the beginning, a lot of people were talking about transmission on surfaces. And that's why masks didn't seem important, is because we were talking about it as transmitted in a completely different way. If you're approaching that from a technology perspective, what you're doing is you're saying, here's the known science about this disease. Here are ways that we can model aspects of that known science using data that we have access to and proxy it for or provide some increased capability, some increased insight. And what we're seeing is that actually when the science is as underdeveloped as it is around COVID, and when you really need a huge amount of data, when you're trying to figure out transmission, like how it transmits alongside who it transmits to, I mean, as it sort of always happens, but is much, much more difficult here than it was in Ebola. You're starting to look at how does the app produce data that's useful? And so I think that to your point, proximity is the thing that we use as the indicator right now. And proximity, when we're measuring through Bluetooth, and in most of the apps are using some form of Bluetooth at this point. And it's a weak indicator. Right? Like if you're wearing a mask and you're outside, and it's potentially a very different risk threshold to being inside or not wearing a mask. So there are all of these contextual factors that actually make the technology design quite experimental. And I think that that's one thing that's really similar, is we're seeing the turn to experimental technology as a sort of very hopeful but not very scientific approach to solving the problem.
So, since you mentioned hopeful and experimental, one argument that I keep hearing in favor of tech solutions, specifically to contact tracing in India, I hear it all the time, is that even if it does not always work all the time, it can make things worse. Why is this a wrong argument? Could you just dwell on that a little bit?
Yeah, absolutely. I think that it's a really common instinct during times of disaster to think, well, it's so bad, we just have to have something. And as a set of humanitarian responders tried that for a long time, and it turns out it's what you can do quite a bit of harm. What we're finding is that the problems of technology are the problems of technology, and so when they're known, when we go into a new setting, we know and introduce the technology, we know we're bringing the challenges, things like interoperability, things like energy, access to energy, certainly the very real economic considerations that go into various device adoption, various amounts of internet usage, various amounts of comfort and skill in digital spaces. So there are lots and lots of known differences that digital tools amplify. But what we're seeing is that I think we don't have a very good sense for how those problems map into how much we know about what value those technologies will really deliver. So we know the problems. The benefits are also very known sometimes. We know that communication is faster, and that when communication is faster, response can be faster. But what I think that what we're really trying to say, and I think this is also is similar to what happened in Liberia and during the Ebola outbreak, our rush to do something means that we become pretty bad at distinguishing what good things to do are and what bad things to do are. And so what we do is we waste a lot of time and a lot of resources and a lot of good energy focusing on really edge case, unlikely solutions instead of doing the things that we know are valuable, right? If every person who was downloading an app or was thinking about how to participate through technology was instead focusing on PPE production or supporting members of their community in need or investing in resilience infrastructure, I think we'd see a very different response, both qualitatively and quantitatively, to COVID. But I think that because we're focusing on technology and because we're focusing on surveillance instead of, engaging with people and meeting them where they are, we're seeing a policy architecture emerge that can really punish you for something as something as innocent as living a normal life and as you were instructed to, and so I think that it's a really difficult context to be hoping for technology to solve what we know to be very entrenched and knowable challenges. And I think that's what makes it experimental. And it's also why we need to protect our protections, essentially. The quick example, I'm sorry, this is longer than I meant it to be, but when you look at vaccine trials, right, we don't go from I invented a chemical to let's deploy it on millions of people, because there's a couple steps we need in the middle to make sure that it's good, that it works, that it doesn't cause harms we don't know about. The human trial process gets compressed during emergencies, right? We see very large upticks in prioritization. We see reductions in administrative barriers. We see lots and lots of energy go into conducting those experiments rigorously. But we do that because we know that the cost of getting a vaccine wrong is also huge, right? And so what's important is that when we do speak to something with the weight of science, that it has that validation, it has that experimentation process behind it, and we're able to speak to it with that degree of clarity. And otherwise, what we get is a lot of garbage medicine that hurts people. And so you can very much hurt people by not engaging with the substance or potential for harm in an intervention.
Yeah, so it's actually good you mentioned the vaccine and the vaccine trial, because, just to bring it back down to earth, that this app is kind of it's like a vaccine which is being deployed on people like a live experiment. So, I mean, in India, it's not mandatory by law yet, but it is kind of mandatory as in compulsory for many things, if you're a civil servant in many government offices now, you have to go, you have to install this app by government order. There were gas station attendants who had to forcibly install it, otherwise they would probably be fired, people in those contexts, they don't ask. They just do what they are told, many of them. So it's a kind of force down from the top, that kind of idea. So it has implications, like in the context of a vaccine trial. In this case, if the app flagged you wrongly or rightly, you could lose your job in many cases, and your wife could lose her job because you got flagged as positive, and you went home, and your wife, because she's in proximity to you, she got flagged with a red flag, even though you were completely okay, So there was a case just from a couple of days ago. I mean, if you just search on the Indian internet, you find dozens of cases like this. I think most of these people don't even come on Twitter. There was one case, I'll just read out. The guy is called Jemin, and the case was reported. He was flagged as positive because somebody got tested for COVID, and either by accident or on purpose, somebody put a fake number, and that number turned out to be this poor fellow's Jamin's number. So when he installed the app, it showed him as COVID positive, and which was a shock to him because he had never installed the app, and he couldn't understand. And then he has essentially gone and flagged the app people on Twitter, who have responded by saying, let me read out the reply, because you need to be a scientist to understand this reply. Just imagine, this is a common citizen. It has been reported here that some test lab has wrongly entered the phone number, due to which app status has turned red. Since Aarogya Setu gets data from ICMR through APIs, it is essential that necessary correction is done at the back end after verification. Imagine that, the guy got flagged as COVID. He might, his office has probably told him, don't come to work anymore, 15 days. And, now it's the era where if you ask to stay at home and not come or whatever, they could disfire you.
You're touching on three things that three things that I think are really, really important as themes, right? One is that this information is not a notification in an app. Your health status, when it comes to most of the way that public health is regulated, means that you have to be in a position to receive care or get expert advice. You have to be around a professional in many instances to receive health news. Obviously, it's different in a lot of places, but the main point is that we recognize that being told that you might have a life-altering illness is not common information, and that when we deliver it to someone in a way that we know will impact their lives, we can't take that as casually as we would take a notification about your dinner being ready or on its way or something like that. And I think that fundamental kind of humanity and care piece is a really important element of not getting too swept up into the role of technology. But I think that, a second and really, really important piece of what you're saying is that it is often second order effects that make things like apps extremely dangerous, right? It's not, as you're describing, whether the app is correct or not. It wasn't, but that's sort of immaterial, because what is happening is now a number of employers are making decisions based on that. Like you're saying, your access to revenue, your access to the economy, your access to well-being in many instances is going to be gate kept by this thing that we know mostly doesn't work. And this is really often how it happens. This is often the kind of main set of issues. It's these second order effects. So it's really, it is not easy enough to convince a government not to abuse the technology, but it is comparatively easier than convincing an insurer not to factor in COVID mitigation around the way that they engage with businesses. So what you start to see is that there are these infrastructures that become very risk avoidant. And the fact that it's a probabilistic risk, which we would not which generally speaking don't tolerate from employers related to how they engage with the labor. But the fact that it's not certain doesn't even necessarily matter in a lot of contexts. And so I think that we're seeing, the second order effects of this are huge. And then I think the third piece, and I just want to, because you did such a beautiful job of explaining it in the way that you told that story and the way that you brought the use case up, but our engagement, our accountability through these systems. The ability to track down an error and to be told, oh, it's a back down, it's an API problem, and on the other end of this impenetrable terms of service, they should be upholding a guarantee that you will not enforce in any court. There's a real scary indignity to being given the runaround to make sure, when what you're trying to figure out is, why do you think I have a life-altering condition that is affecting a pandemic? That's the kind of thing that you should have to be pretty sure about before you start telling people they have things. And the complexities that go into accountability when what you're dealing with is like a technology or a data supply chain, as opposed to, say, a doctor or a public health services provider, is a really, really different, it's a fundamentally different construction. And it's scary to me. I don't know how to not, it's very unsettling to not know how to verify information that you receive through official channels about your health status.
In one sense, it is actually far more damaging than, actually taking a test for COVID, and it gives you a false positive. At least you can go and retake the test just to re-verify, whether that, because you can see on the box of the test that what is the false positive rate, what's the false negative rate. The app does not have anything on it like that. They don't have any data, they don't have anything. So, it's not just the Indian app, but it's the case with all these apps all over the world.
I think that's one of the pieces that people really haven't brought up enough, is that the heads of almost every major program who have run contact tracing apps are saying they don't make much difference. So the heads of the program in Iceland, South Korea, Singapore, South Dakota, across a pretty broad range of contexts, all of the early indicators is that it doesn't make much actual difference. But the one thing that I think does make a difference, and it's the point that you're really focusing on, I think, and well, is we talk about these notifications as though you might get one, right? Like, you're going to get a notification and then you're going to make a decision. What if you get 100? What if you keep getting 100 no matter what you do, no matter what you change about your lifestyle? What if there are ways in which you can't change your life that still expose you to COVID, right? Our ability, our focus on this as a probabilistic risk score means that we don't engage with the humanity of people who have to, we treat it as a risk, not as solving a problem for a person. And I think that's when we start risk scoring health quality and health status, as we already do in many instances, of course, but in this way, and as this large of a gatekeeper, it has a bunch of very concerning second order effects.
And there's also the case that, not everybody in the country has a smartphone. There are many people I know myself who just have feature phones or don't have phones at all. And then there's also the expectation that everybody's got to have the internet. And I read in your paper on Ebola that some American billionaire came and flew in and gave thousands of mobile phones to everybody, but then people had to recharge. And getting cards, being able to afford cards, recharge for data access was very difficult for many. So I don't know what you have to say on that, but for sure.
I think that it's an endemic problem to short-term thinking, right? Is that a lot of times what crises do is they reveal fragility, and it's optimistic in many ways, if not somewhat naive in others, to think that the absence of a device is the problem, right? And technology solutions to international disasters, to domestic disasters, very much have to draw on the capacity of the people and the services that they're connecting. And so there are these limitations that I think technology doesn't always do a great job of explaining or reflecting. And I think that, smartphone adoption has always been a barrier. It's why I work in SMS. But I think that, for the most part, what we're trying to do is make it as accessible as possible. And what we're learning, mobile phones obviously are variably accessible, but COVID susceptibility is not, right? And so what we're finding is that the structural the structural challenges that that create the unevenness of mobile phone adoption are also creating real fragility and unevenness in the way that people engage with the response. I don't know whether or not I've lost Ashok. Welcome back.
Hi, sorry. I don't know what happened there. Yeah.
You missed nothing.
Yeah. Okay.
But yeah, no, I think that what we're seeing is that there is no kind of billionaire act of one-time generosity that is going to fill or level or change the underlying circumstances in ways that affect or really meaningfully change, our ability to respond to COVID over a long period of time, because those are structural and systemic problems that need real attention.
So, since you talk about structural and systemic problems, one thing that is very different between India and, let's say, Korea or China is they have public health systems. They have functional public health systems. They have infant mortality rates, which are like, say, in Europe or in the US, maybe better than the US. And they have public healthcare. You don't need private insurance to get safe healthcare. So, in India, somehow it's very bizarre to me that people think the app is an answer to not having a public health system. So, isn't that the case? I mean, with every other country who have handled COVID to some extent, and where the app was just an addendum to the presence of hospitals and PPEs and masks and hospitals and doctors and staff who knew what they were doing. Is that the case?
It's hard to argue with. As an American, we don't have a public health system really. Certainly not one that meets people's needs the way that you're describing. So definitely, and given the state of our response, it certainly bears out as a theory. I think that it is true of public health systems specifically, and it is also true of collective support structures broadly. And I think that what we're seeing is that leaders that have acted in a limited but transparent way have had more effective engagement. People that have shied away from politicizing, making it a political issue, and focused on the science and the public health nature of it, have been more successful. But I think to your sort of specific point, public health systems and social infrastructures and safety nets are why, this is why they exist. And I think that we're seeing both because of the privatization of a number of vital industries, but as well as sort of our focus on individual action and individualism over collective action in many ways. You're seeing a lot of different factors, a lot of different social safety nets play out, social design infrastructures. But I would say that I think that giving people healthcare is pretty obviously the right thing to do, and certainly when the entire health of the world depends on it, as it seemingly always does. So one of the things I am finding really interesting is I was doing some work recently with some folks in public health, and you're seeing a real culture change in the narrative of international debate about public health, which of course there has always been a strong kind of pro-public medicine case, but I think you're now seeing this become a really galvanizing moment because it is so clear how interconnected everybody's health is in this pandemic. I think I got you on mute.
Sorry. One thing I just wanted to touch upon again is, this use of apps and, this belief that tech is going to solve everything. I don't get it. Why are people somehow blind to the fact that if the hospitals are not there, if the PPE supply chain is not there, if the masks are not there, it's not going to work if there's an app. But somehow I see that tendency a lot in people I know, this app will help me. I don't know, is it connected to being able to order food on an app and it comes home at the press of a button? So maybe the app is going to wish away COVID and build whatever infrastructure is there required for it. I mean, I don't get it. Maybe you have a perspective on that.
I have a perspective on it. I don't know how right it is, but I think at the individual level, it's really understandable to want to believe that something is happening, right? And I think we all want that during times of great upheaval. We all want someone to have a plan. We all want there to be something that will fix this. And I think that what we're seeing right now is that in a lot of places, in a lot of instances, there just isn't. There's not a plan. In some places, speaking for my own country, there are elements of our leadership that seem to feel like actively against our response. And so I think that there's a real, where there's a void, right? Irrational hope sometimes steps in. And I think that, it's also not really fair to put this on the individual. There is a lot of money that goes into building surveillance technologies that then needs new use cases, right? New growth arenas. And we're certainly seeing COVID apps become that. We're already seeing data breaches. We're already seeing commercial contact tracing apps that are selling data back to advertisers. This is the same kind of churning tech industry machine that existed before COVID. And, whenever another major issue arises, I suspect we'll see a lot of technologies, a lot of surveillance practices and technologies pitched as the sort of solution there too. So I think that, to your point, I think that there's a lot of I really hear what you're saying on the individual level. I know a lot of people really struggling and also who think that the app really might do it. And people don't really want to say no when there's so much hype and so much public enthusiasm. But I would also say that there's political value to this, and that's sort of full circle, right? It's that person's hope, that person's irrational hope that someone is doing something that will solve this, is also a government's kind of cushion from accountability. Right? We can all be going to government and saying, we know that PPE isn't there. We know we need better hospital beds. We know we need, all kinds of healthcare system capacity that is very not technology driven. And I think that if we're doing both, then maybe great. But all the way back to the beginning, I don't think that it makes any sense for us to be pinning this amount of hope on something so unvalidated, so unproven, so experimental. And I think we should expect more responsibility and more accountability from both the corporate actors and the public actors who are lining up to launch these technologies without a really clear impact statement, without a really clear view to actually making a difference in the response, and often without any real articulation of what success would look like, failure would look like, or when and under what conditions they'll shut it down. And to me, those are all things that more mature industries take as preconditions for even getting involved. And so I think that, a lot of what we're seeing is that this is an opportunity for technology to grow up a little bit, right? And to be able to build its research and development infrastructure, to be able to speak to its value proposition in ways that are more certain and less experimental.
I mean, to me, it is very interesting that, like the tech to battle COVID is really ancient tech. I mean, if you think about it, quarantines go back to the Mosaic Law in the Old Testament. The mask goes back to the Black Plague, people putting on masks to keep diseases away. Even PPEs, if you see doctors in Venice, I mean, the whole Venice festival is about wearing some kind of mask with some kind of filters inside to keep the smells out. So, to me, isn't that really, that is all that together is more effective than app-based contact tracing. I mean, to me, it is very bizarre. You have AIs, robots, self-driving cars, but we don't have this. I can buy a robot on the market that can make me 10,000 masks in an hour. Yeah, so, to me, just to give a very laughable example, but, to me, hasn't COVID really exposed the failure of tech to a large extent? I mean, they were focusing on the wrong things to a large extent.
It's such an interesting question. I think that it's, in many ways, it's less about, is it a failure of tech, and is it a failure of our ability to remain kind of self-possessed adults in the face of tech, right? And I mean that at the individual level and at the collective level, because you're right that a lot of what we're talking about is an approach to developing something new, some moonshot, when in fact what we know more often is that the simple things that require work and discipline do the job, you know. And this isn't new in public health, right? Like we all I don't think diet and exercise are new medical advice to anybody, right? And yet in a lot of contexts, obesity is a major issue. And that's not to say that that's just a question of discipline by any stretch of the means. It's a way of saying that putting personal responsibility and even knowable treatments isn't necessarily the solution, right? We have to create an environment in which a more complicated environment that involves things like social safety nets. So yes, I completely agree that this idea that we're going to invent our way out of every problem is a dangerous one for the way that we define social safety nets.
I mean, I speak to doctors and I speak to, medical practitioners, people in this space, but they got it from the beginning. They understood, they even told me, what's an app going to do? I need a mask, or, I need a PPE. But somehow, as you say, perhaps there is an element of making people happy with an app like this and feel a bit safer while, I do see your point very well there, that it's just a tool.
There's an old presentation that I used to give that had a 2-slide progression that comes up a lot. And I'm only bringing it up. The first is sort of like what science fiction promises us. And it's this painting of this beautiful utopia. We're all in flying cars. The earth is green, and bountiful. It is a vision, right? And then the next slide is, and what did tech actually give us? And it's a room full of people sitting with virtual reality headsets on, right? And I think that this is a lot of what we see. This is a lot of what is important to be. This is why critical thinking around tech is so important, right? Is that tech is very good at giving us the appearance of things, but it is not always as good at giving us complicated or difficult things to build. And I think that we have to be really careful about what we assume tech can build based on what it shows us. And so I think that what we're seeing here in a lot of instances is a palliative. It's a nice thing. It makes you feel better, maybe that there is some technology approach or some tracking approach that will be progress. But I think that emergency is a very difficult time to be irrational and hopeful.
The other thing they've done, at least in the Indian contact tracing aspect, is because they got a lot of pushback, they said, we'll do it open source. And what they did was they just took the front end of the application and they made that open source. And, I have personally, to me, the whole concept of the app itself is not functional. So making it open source, how does it solve the problem? I mean, you might have a different view on that. Is it of any benefit here, in this centralized contact tracing context?
I think that open source is necessary, but not sufficient for something that requires this amount of public trust. I think that it's fair for people to want to understand the code, and that there are a number of really important sort of security standard testing and generally understanding and capacity building reasons to open source code. And so I think doing that is positive, but it's not sufficient. Right. And the license of a code is not, or even, being able to understand code is not the same thing as the license of the data or the operational security of the parties involved in managing the data throughout that supply chain. I mean, you mentioned, the gentleman had several different services he would have to interact with in order to understand his COVID diagnosis, and presumably each one of them have terms of service agreements and legal architecture. So I don't think that open sourcing the code does not solve the problem of, is this a good app? It doesn't demonstrate a positive public health impact, but it may help some proactive folks go in and limit harm or make sure or reduce some of the things that could go wrong, which of course is a positive thing.
So basically open source cannot turn a bad product into a good one. That's what you're saying.
It can't turn an ineffective product into an effective one.
into an effective product. There's one question that I keep getting from people is that, so it seemed to work in China and in South Korea, this whole business of using apps and technologies, they've done it there in China and Korea. So why isn't it good for us? So,
the shortest answer is because they shut down when they get bad news, right? Even in the best of circumstances, a COVID app can only give leadership information about rate of infection, right? Leadership in South Korea and in China and in a number of places have chosen, based on that information, to resume lockdown and to engage test and trace sort of programming. So to your point, I think that there's a lot to be said for health system capacity, which is a big deal. But I also think that there's a lot to be said for leadership that is willing to transparently and frequently shut down in case of breaches of containment. I think that that's what allows that. And so where you have governments that are unwilling to take action to shut down or are unable to really compel containment, there is no app that fixes that.
And even, I guess testing is a big part of that, because I saw that Beijing alone has a testing capacity of 1 million a day. So, I don't think they're doing 1 million tests a day in India, leave alone, forget about a city the size of Beijing, the whole of India, they aren't doing 1 million tests a day. So, I do understand what you're saying. There's a question here from Divij Joshi. How do we assess voluntariness or consent in a situation where you are being sold a bridge to health, particularly by the government? If you wanted mass participation in some sort of widespread digital contact tracing trial, what's the way to ensure informed consent?
I love that question. So there is a whole space of humanitarian research ethics. And one of the things that's really fascinating about apps is that they can solve one of the major challenges around consent, which is that anything that acts as a bridge to a system theoretically remains up. So you can continuously get new consent. The way that people's rights are typically protected in large scale and emergency experiments is through a heightened degree of transparency. So the people who are performing that experiment very typically have to tell you quite a bit about both the methodology, what it is doing, what they're testing, and how it works in your body, what things you need to look out for. They do a significant amount of increased monitoring. So if you participate in an experiment, you get an elevated level of care typically, or at least an elevated level of sort of monitoring and awareness by the public health provider. And importantly, research ethics also impose some requirements around necessity, proportionality, and accountability. So essentially, it is illegal in most places to do unnecessary or wildly disproportionate experiments on humans. And you sort of always have a due process right to leave. And so one of the things that I think is really important and really different here, right, is that we're seeing a government launch an app and in any way make it compulsory is to exert a type of government power that is typically only available during emergencies. So a government normally cannot force you to download an app without a very compelling public process. And here what we're saying is a government may force it. And even if they don't force it, they may create a set of conditions, like letting your employer require it, that functionally or constructively force it. And those are the kinds of policy protections that when one is designing an experiment as an experiment, that the structure of the process, generally speaking, you kind of work through some of those concerns, and you also work through those accountabilities and you take on those roles. So there's a lot of progress to make just in what we know, right? That's not to suggest that consent is perfect. I think that the question is also really pulling at this idea that if it's a bridge to health in the middle of a pandemic, is it consent, right? It's in law, it's called cohesion, or adhesion, sorry. And that is essentially that you make an agreement against your will. And there's a really compelling argument that in humanitarian response, any consent that you give is basically being given against your will because it's being done under duress. It's being done so that you can get access to something really basic that you need, something really fundamental and vital. And so I think that that is a broader question, which is really difficult and really contextual to answer. And it's why those principles and the sort of systems that regulate and oversee human experimentation are so important, and also play such a role when we do things like vital science during emergencies.
So in a sense, just correct me if I'm wrong. So inflicting an app like this on people, making it mandatory in the middle of an emergency is kind of like doing a challenge trial with a vaccine. In a challenge trial, you basically inject people with the disease, and then you give them the vaccine. You first inject people with a vaccine that you don't know if it works or not, and then you give them the disease. And they are kind of the live experiment, these people. It's a way to speed up vaccine trials, done probably only in very adverse situations or in countries where they do it on prisoners on death row or something like that. So is that a fair analogy?
The Chinese military is doing this now. The Chinese military has started on vaccine trials, on human vaccine trials. And so it's a really interesting set of questions, right? Is how do we, what is the consent there? I mean, presumably as a military officer, they have a very different sort of due process footprint to what you might expect to an average person in that same context.
There's just another thing I wanted to touch upon, which is, if I read Indian media, for example, but even if you read media in other countries, the general trend has been not to try and understand the tech, but to reflect the same biases in the sense that the tech is great, it's going to help us. So I see it only in very selective journalists or, in very selective parts of the media where there was critical questioning of tech from the beginning. Now there's a lot more people waking up to it because there are people reporting issues with it and so on, but it's still not enough. There seems to be an implicit belief it's okay.
Yeah, I definitely, as someone, I definitely hear you that there's a real strong, there seems to be a very strong, what I usually call it is inevitabilism. It's this idea that technology is inevitable. And so therefore we must find ways to accommodate it, as opposed to technology is, we can say no, which we can, of course. But I think that, I think that the over-reliance on tech creates really big blind spots. And there's some of the ones that you've been touching on, throughout. There's older tech that works, that we know it works. There's solutions here. We know what it means to invest in social safety nets. So there's a lot of things that I think, a lot of misdirection that goes in the direction of technology. And I think that we're starting to see, productively, as you say, we're starting to see a lot more critical diversity in the way that tech is getting covered. But I think that we're also starting to see the failures of our protections, right? For example, whether you think about your main data rights coming from data protection, as some places do, or from human rights, as other places do, or property rights, as is popular in some places, there are a number of ways in which people are trying to engage with how we control, how we get control. And I think that what we're seeing is that we don't have a set of protections that are future-proof, right? Privacy ultimately will not prevent the kinds of harms that a COVID app creates. And privacy alone is important. And it is a set of protections, that we want, that lots of cultures want to carry forward. I say this from the United States. There's a lot of patchwork, efforts to build a privacy law here. But I think that the thing to say is that not only do we have this kind of problem with the means of control, but we also we have this problem with that our defenses aren't future-proof. Our defenses don't, and so the tools that we have to kind of manage these things, emergency powers are always going to be bigger than privacy, for example. So we need to be able to think about, what do digital emergency powers look like? right? Should a government be able to compel you to download an app? Why? And under what conditions and under what sort of accountabilities? And those are the ways that we define protections in most other, that's the way that we limit government power during times of emergency in other domains. And so it's just from my perspective, and I'm sorry, I acknowledge it's a bit of a tangent, but just to say that I think that it's really important for us as people who are concerned about these issues to be thinking critically and creatively about how we might protect these interests and these rights in the future, not just what exists now.
Just on that context, since you mentioned the future and emergency powers, so there's a possibility that this pandemic is not going away soon. It's going to be there for the next year, for the next 2 years, for the next 3 years. We don't know. So, is there a context, keeping that in mind, where what's the context where a techno solution could actually be useful, and in terms of, should it have a sunset date? Should it have a clear sunset date? What's the context for it? It's not forever. Does it require a sunset date? Do we need laws that mandate its precise use of every specific bit of technology? If there's an app that needs a law controlling it, what is its specific use? And what happens to people who are flagged by the app? Do they lose their rights? Do they keep their rights on? I mean, is that something, what would work?
Yeah, it's a good question. I think to your point, I think that you touched on something that's really near and dear to my heart at the beginning, which is that we need a diplomatic capacity around digital issues, and I haven't seen the infrastructure arise for it. Obviously, there are international organizations, and many of them have important and relevant mandates. But really specifically, each of these countries, everyone who is experiencing COVID in one way or another is making decisions about how it will respond, what standards it will hold travelers to, what types of technology and monitoring we expect, what type, as you say, what type of wind down, what are the conditions? Is it only for citizens? Is it for everyone who's resident? How does it apply to different populations? How do we apply that same set of concerns for people who don't meet the same technology needs or the same technology requirements? I think that I think that what we're looking at in a lot of these instances is not that we're going to get to a techno-solutionist response. And in many ways, if we do, it is sort of a failure of all of the other systems, which is, which we don't want. So technology, generally speaking, it's a marginal solution. It improves the rate and speed of things, but it won't fix political disagreements. It can't fix intransigency. And ultimately, we're not going to predictively model our way around the need to provide basic human care to people when they need it. Especially during a pandemic when all of our individual healths are so inextricably linked. So I think that rather than think about what does it look like for this technology to work, I think it's more useful to think about how are we able to participate in deciding what we want this response to look like. And some of that is, of course, the things that we can create. But a lot of it, I think, we have to find other avenues to participate that aren't just, I'm going to invent something, right? We need to be able to find vehicles of participation. We need to be able to find vehicles of collective action. Some of those will be technological. Most of them probably won't, right? I mean, lots of gatherings have nothing to do with technology, thankfully. I'm told. I've attended at least one, I'm sure. But the point is that, that I think that the most successful thing that we can do in the narrative around techno-solutionism is to recenter the debate about solution outside of technology, and to reorient that technology is in support of a broader and more holistic solution than it is a solution in and of itself. And from my perspective, the places where I see technology driving the most conflict or driving the most potential for bad outcomes, are really in need of governance. They're because we don't have any space to have conversations about political speech and biosurveillance. Or, what we just have are people who are great at analyzing it and talking about it and writing about it, but we don't have participatory decision-making spaces. And I'll just end with this piece. I got into technology in the very beginning because of access to justice. And actually, India was one of my first use cases because one of my first sort of examples and concerns, because the backlog of civil cases is so large in many instances that it can be difficult to process, just administratively process law. And so in the United States, this is also true. There are a huge backlog and a huge unevenness to the way that people are able to protect their rights. And, to take the example, the very human example that we gave, if that person wanted to demand accountability, they would presumably have to get access to a court. They'd have to put together a case. They would have to, fund that case, wait the amount of time it took to litigate that case. And then they might not even, by then, if whatever the disposition is even still matters, then it might be some small amount of financial reward. It might be some small amount of, you might get a rule change, but it really depends, and it's pretty unlikely. So, as I know that you've got a deep experience in legal technology, I came to Frontline by starting the Frontline Legal Project. But I think that the reason that I focus on that, and I think that one of the things that I think is critical to think about with any COVID app, is that any app that launches should also have a dispute resolution system embedded in it, right? That we should be building technologies not only expecting, that we'll take them to court if they get it wrong, but that they build that capacity into the system itself so that participants can shape the rules as they go. And I think you get a lot further that way. Of course, governance design gets more complicated, but it's that dispute resolution piece. It's that how do we make sure that the things that we're creating take responsibility for and give people access to remediation in the kinds of problems that they cause, not just, turn it off. And I think that as we recognize that complexity, we're getting deeper and deeper into understanding the need for digital governance. And that's really how most of my work ties together.
Okay. No, I think, that's a great way to, to basically close the conversation, because what you mentioned about the app being like a one-way traffic at the moment makes no sense. If you fail an actual COVID test in the medical space, you can go and retake it. So in real life, when you get really tested, you can go and retake the test. But in the app, it's not there. That's fundamental lack of thinking. I don't know how it can be modeled like that. Thank you very much for this really enlightening discussion. I believe I've learned a lot myself, just talking to you and talking about your experience, and I'm sure the audience has also learned a lot out of this. Incidentally, I forgot to mention Kaarana, so I just want to thank Kaarana for putting this together. They are a group of active people in they were originally people active in the Aadhaar space, and now it's gone beyond that. It's mostly in the digital rights space, and it's a brilliant bunch of people. I learn something from them every day, so I just want to shout out to them, everybody, Srinivas, Zainab, all the people who put this together. Thank you.
Absolutely. And also just to say that the work that you're doing and the context of India and it's the convergence of public and the public service and infrastructure and technology is so incredibly important, both globally and domestically. Obviously, I feel like I learned from the work of this group and the group of people all the time. Just to say thank you from somewhere very far away.
Sean, if I can take 2 minutes for one more question. So there's an important aspect, I think, we did have a discussion around this in the past on what's happening in India is that the government is using crisis at every moment. Like there's a lot of talk around disaster capitalism around the world right now, especially with the push of 5G in US and driverless cars and this whole idea of contactless technology systems that we need to build that's being pushed by everyone, right? So we are also witnessing a similar trend within India where the government's now trying to promote health responses through technology, right? Through telemedicine and stuff. And the contact tracing app kinda is going to stay around, and they're trying to build data trust. This is something that you have really worked upon. So if we are building some of this based on the current crisis, how do you think these things should proceed? I mean, that your organization, Digital Public, works a lot on that. So
yeah, thank you for the question. I think that it gets, I'm worried or wondering how much we're going to see a kind of wave of legal solutionism really similar to techno-solutionism, where people really confuse instrumentation for good or equitable governance. And so I think that data trusts are one important, they build on fiduciary theory and law. There's a lot of useful tools available through trusts and through accountability and transparency, the way that trusts create. But they are an instrumentation, right? And so they are also very, trusts have been used to manage assets both in front of government attention and away from government attention globally for a very long time. So I think that it's in some ways very encouraging to hear a government recognize the complexity of the social complexity of asking a population to engage in some of these services or to build into this kind of technical or digital infrastructure. But I think that you have to look at the governance design of each of those trusts, and you have to think about what rights does it really give the people who are reflected in that data, who are using that data, who could be harmed by that data. And so it's really the governance design piece. And then to the extent that that governance can be accessible through that technology stack, I think that's the other piece of that, is that you need the mechanisms of dispute resolution and changing the system to be available at the point where the person experiences that. And so if that's through technology, then that has to be in the technology itself. So in a lot of ways, I'm really hopeful about, things like telemedicine are very old. They obviously happened long before mobile phones, and in some ways, are underexploited, and in some ways are overexploited. But I think that, so rather than, from my perspective, and of course you will have picked up on this as a bias of mine by now, but I think it's most important to map the power or map the relationship to power mediated by a technology than to focus on the technology itself. And so when you're focusing on what rights does this change or afford me or not afford someone else, and what issues does that introduce, those are the places where I look to intervene. Those are the places where I think groups like you all have so much opportunity, because a lot of it's capacity. A lot of people just don't know about research ethics or experimentation work and design. So a lot of it, there's a lot of room to move the conversation forward positively. But it is, anything that a government or a company or a person says, look, this is it, this is a solution, we just did this, we solved this political complexity by giving you X, right? Is almost never the case. So engaging with that political complexity and focusing on the governance design that comes out of data trusts, I think might be a really interesting opportunity. But certainly using them by themselves won't solve much.
thank you, Sean.
Sure thing.
I guess that's it. I just want to check if anyone else has a question. I haven't seen anything on YouTube or Zoom. Maybe we can just end it here. Yeah, no questions.
All right. Thanks.
Thank you. Thank you, Sean.